Bernie Sanders asked a simple question that should not be controversial. Is healthcare a human right? What followed was a dodge, a deflection, and a reminder of exactly why millions of Americans are still one illness away from bankruptcy.
Thank you, Mr. Chairman. Let me start going back to prescription drugs. Mr. Secretary, did I hear you correctly to state that your goal is to have Americans pay the lowest prices in the world or equivalent to what is paid in other major countries? That is my goal, that you are prepared to work with us on legislation to achieve that goal.
Absolutely.
All right, and I believe there's bipartisan support for it. I believe that if the leadership here prioritizes that, we can do that in a very short period of time. Look forward to that. Let me ask you this, as Secretary of HHS. We have in America today some 85 million Americans who are uninsured or underinsured. We spend more per capita, as you've indicated, than any other country. Is healthcare a human right? Are we making America healthy when so many people cannot afford to go to a doctor, when 68,000 people a year die because they don't get to a doctor when they should? Is healthcare a human right? Will you work with us to guarantee healthcare to every man, woman, and child in America?
Well, I think you're asking two different questions. You're asking a philosophical question about whether it is a human right, like a constitutional right. As an attorney, I would say that it's not a right of a kind that we otherwise enshrine in the Constitution, because healthcare costs your neighbor money. If I smoke cigarettes for 20 years, I make that choice, which is my choice.
I don't mean to, I don't have a lot of time, so I am here.
If you're asking me a philosophical question, I got to, give you a thoughtful answer.
Within 30 seconds.
Yeah.
It's a problem.
So, it's not like freedom of speech, which costs, every.
But every other country, Mr. Secretary, every other country guarantees healthcare to all people as a right. Should we, as Americans?
The objective is to get Americans the level of healthcare that they want, the choice, which Americans want. Americans
They don't want the choice to be uninsured.
Well, but
They don't want the choice to die because they don't get to a doctor on time.
Americans prefer private insurance to other insurance sources.
Do you believe? Okay.
And what I would say is, I want to find a solution to this. I want every American to have insurance. President Trump wants every American to be insured and have access to health care. The question is, how do we get there? Obamacare is not working. It is not working. And this is the... Sorry to interrupt you. All right. The reconciliation... My job is to try to make it work.
All right. I have limited time. The reconciliation bill that is now being worked on in the House will come to the Senate. As it stands right now, cuts Medicaid in the Affordable Care Act by more than $715 billion, which the CBO has estimated would eliminate health insurance for 13.7 million Americans, and also raise co-payments for millions of others, is throwing 13 million Americans off of the health care they have, poor and working class people, keeping America healthy.
Well, I haven't seen that number. I've seen the number 8 million. And here are the people, the cuts are not true cuts. The cuts are eliminations of waste, abuse, and fraud. And I can go through. I can go through the people who will lose it. There are a million people. There are a million people. I really don't mean to be rude,
but as you know, I have a very limited amount of time.
You ask a question, I'm going to answer it.
Well, yeah, I've got a bunch of questions that I would like you to answer as well. All right, we talk about austerity, doing more with less, but in that very same bill that is being worked on in the House right now, there are $235 billion in tax breaks for the top 0.2%. Do you think that makes sense when that same bill would throw 13 million people off of Medicaid? Should we give tax breaks to billionaires and throw kids and others off of Medicaid?
You're conflating the congressional bills with the proposals from the president. The president
No, I'm talking about the congressional bill. I'm talking about the bill, the reconciliation bill.
I mean, the president is not trying to do tax cuts for billionaires. He's trying to have no tax on tips and no tax for
$235 billion by
how many billionaires do you know that are making overtime or making any part of the
$235 billion. Look, it's a big bill. There are a lot of provisions in it, but you cannot deny it. The top 0.2% will get $235 billion in tax breaks while we cut Medicaid. Okay.
What you just watched was not a misunderstanding. It was not a slip of the tongue. It was a deliberate refusal to say out loud what every other developed nation on Earth already accepts as basic truth. Bernie Sanders laid out the reality clearly and calmly. The United States spends more per person on healthcare than any country in the world, yet tens of millions remain uninsured or underinsured, and roughly 68,000 Americans die every year simply because they cannot afford to see a doctor. That is not freedom, that is failure. When Bernie asked whether healthcare is a human right, RFK Jr. didn't answer the moral question. He retreated into legal technicalities, philosophical word games, and personal responsibility talking points. That completely ignores structural reality. He compared healthcare to free speech, argued that illness costs your neighbor money, and implied that poor health outcomes are the result of personal choices rather than a broken system. That argument collapses the moment you realize that cancer, diabetes, childbirth complications, genetic disorders, workplace injuries, and childhood illnesses do not care about ideology. Every other major country guarantees healthcare because they understand something basic. A society cannot call itself free when access to survival depends on income. Bernie exposed the real contradiction when he pointed out that the same reconciliation bill slashing Medicaid by hundreds of billions of dollars also hands massive tax breaks to the wealthiest Americans. You cannot claim you want everyone insured while actively ripping coverage away from millions of working-class families, children, seniors, and people with disabilities. The most revealing moment wasn't the policy debate. It was the avoidance. RFK Jr. would not say yes, because saying yes would mean admitting that healthcare should not be a commodity, that billionaires should not profit off suffering, and that government has a responsibility to protect human life, not corporate margins. Bernie wasn't debating theory, he was defending reality. Healthcare delayed is healthcare denied, and denial costs lives.